In this video, I will be talking about hypertension, or in common term, known as high blood pressure. What are the things that we need to know about hypertension? First, I will define what is a hypertension or high blood pressure. Secondly, who are those individuals at risk of having hypertension? Third, I will discuss the common symptoms of elevated blood pressure. Next, I will discuss the ways on how to control an elevated blood pressure. Lastly, I will identify the most common medical complications that can be avoided once an elevated blood pressure is controlled. According to studies, hypertension is defined as having a clinic blood pressure of more than or equal to 130/80 mm mercury, or a home blood pressure of more than or equal to 140/90 mm mercury. Who then are at risk of having hypertension? Common risk factors for having an elevated blood pressure includes smoking, alcoholic beverage drinking, aging, hereditary, obesity, and stress. What are the symptoms of hypertension? Some individuals may not present with symptoms, or they are also known as asymptomatic. Others may experience headache or dizziness, neck pain, nausea, or vomiting. Since others can present without clinical manifestations, how then do you identify if you have elevated blood pressure? If you have available BP apparatus at home, also known as sphygmomanometer, you can measure your blood pressure. Otherwise, you have to make an appointment with a medical doctor if you are experiencing any of those earlier mentioned symptoms of elevated blood pressure, or even if you are asymptomatic but you have the risk, it is prudent that you make a consultation. Hypertension is a chronic disease. It means once you are diagnosed of having elevated blood pressure, it is permanent. But how can we control an elevated blood pressure? Several strategies are helpful in controlling hypertension. First, you have to check your lifestyle, and these include a healthy meal, regular exercise of at least 10 minutes 3 times a day, or 30 minutes 4 times a week, having enough sleep, cessation of smoking, cessation or limitation of alcohol drinking, avoidance or limitation of salt intake, regular intake of maintenance medicine, and lastly, regular medical consultation. There are several serious complications of hypertension that can be prevented once your blood pressure is controlled, and these include heart attack, stroke, which can be an infarct or hemorrhage, blindness, renal failure, and lastly, death. To sum it up, hypertension can quietly damage one's body for years before symptoms develop. Uncontrolled high blood pressure can lead to disability, a poor quality of life, or even a fatal heart attack or stroke. Hence, it is very important that you know and understand the risk factors of hypertension, eat healthy, exercise regularly, drink your medicine religiously, stop smoking, stop or limit alcohol intake, and have a regular appointment with your medical doctor. Thank you for listening and watching, and stay healthy because health is wealth.